I'm Sean Ryan, and I am the case manager for UWM Counseling Services. Today, we're going to talk about insurance and community resources for behavioral health uh, community services. And I just wanted to get things kicked off with talking about insurance. So, we're going to talk about if you have insurance or if you don't have insurance. The first one is if you do have insurance, uh, the first thing that you can do is kind of take a look at your card. The front has a lot of good information about, um, your group number, your member ID, which are both critical pieces of information for when you do a referral. The clinic that you call will ask for that information. Um, and then on the back of the card is the customer service number. You can use this at any time to contact your insurance company to find out more information about things like your if you have deductibles, what your copays are, and what they are for mental health services. For medical services, they may be listed on the front of your card, but it may be different for behavioral health services. So sometimes it's a good idea to call your insurance company to find out if there are any differences about copays. For anybody who doesn't know what a deductible is money that you pay sort of up front. Well, not necessarily up front, but you pay uh, for services before your insurance kicks in. So say you have an individual deductible of $1,500. That means you pay $1,500 of service before your insurance then starts to kick in at whatever rate that is. Sometimes it's 80/20. Sometimes it's your doctor just needs to do a pre-authorization for the service so that you can have the service done, but they just fill out a form saying that it's a recommended service. Um, so let's see. One of the big things about that you can ask about your insurance from your insurance company is whether your provider or a provider that you're interested in is in network or out of network. Basically, what that means is are they covered by your insurance based on the levels that your insurance has coverage, or are they out of network, which means basically that your insurance would not cover services with um, that clinician, and then they would need to bill you. That clinician would bill you either for the full cost of the service based on their rates, or sometimes they can work things out with you for partial payment, or for a payment plan based on your income, depending on the provider. Okay, so the next area is if you do need insurance, what can you do? So if you need insurance and you want to apply, you can first go to access.wisconsin.gov. You can fill out the information for state benefits, and they can let you know whether you would qualify for Medicaid or state benefits, or if you would need to go to healthcare.gov to apply for marketplace insurance, which is people call it Obamacare, people call it the marketplace, and so basically that's that's how those levels work. And then when you fill out your information for the marketplace, you go on the healthcare.gov website, fill out that application, and then you have to pick a insurance provider, and they have different levels of provider, um, and each of them has a monthly cost to them. So it's basically like paying out of pocket, like a subscription for this insurance, a like if you had your insurance through your employer. As for access.gov, not only is the application for health insurance, but it's also for other benefits like food share and things like that. So when you apply for one, you're sort of applying for all of them, and they take all of that into consideration. If you apply for Medicaid and get accepted, then you can track your accepted application through an app called My Access, which is available on both Apple and Android. And what you can do with that is track your application, and then any of the follow-up checks that Medicaid might request in the future, because they will periodically send you a request. I think it's about every 6 months they send you a request for to go through your application and to do any changes, like if you get a new job or if your address changes or something like that, because they want to make sure that they get the information to you that you need, and they have the most up-to-date financial information for you to make sure that you continue to qualify. The My Access app also has a function where you can upload any documents that you need to get to them, which makes things easier than it used to be because you had to either send things in through the mail or bring things to the social service building. And both of those things are more of a hassle. So it's nice to be able to take a photo with your smartphone and then upload it right directly to them, so it can be viewed and added to your package of information. I think that is all that I needed to say on both of those. So then once you if you don't have insurance, and you're not going to be getting insurance anytime soon, as far as you can tell, but you need services, relatively quickly, one of the things that you can do is go to the Milwaukee County building, which is on Watertown Plank Road I think it's in Wauwatosa technically. And you can look up the address and map it out for yourself. It does take probably about an hour or so to get there by bus from campus. And the Access Clinic is historically it's been a walk-in clinic. Right now, due to the virus and everything, the Access Clinic, you do have to call to make an appointment at this time. So you call the phone number that I've listed here, let them know what you are interested in doing, and then set up an appointment time, and then they have protocols for keeping everybody safe there. But basically what the Access Clinic is for people who don't have insurance, that are people that have addresses in Milwaukee, which most people do. If you don't live in Milwaukee County, but you do commute to campus, then you would go by your particular county's social service clinic most most counties do have provision for helping their residents get non-insured assistance. Beyond that, the initial assessment is for both counseling and psychiatry, and they do an evaluation to find out what your needs are, and then do a referral from there. If you're not interested in, say, if you're not interested in psychiatry and you just were interested in therapy, you would do the full assessment, and then they have a list of some counseling clinics in the community that they contract with. If you're interested in psychiatry, they can do that evaluation, and then they would let you know whether you qualify for their services at this time or not. There are certain things that they cannot prescribe, and like benzodiazepines and like clonazepam, lorazepam, things like that. They don't prescribe, and they don't prescribe medication for ADHD, so stimulant medications, and they don't prescribe any medical medications. If you are looking for services for alcohol and drug use or abuse, that would be through Impact, and I left their phone number is there, and they take individuals for AOTA assessments, whether they have insurance or not. And then the last option is using clinics that do a sliding fee scale. So if you don't have insurance, but you don't want to go through that assessment at the county, there are some clinics like Aurora Family Services and Catholic Charities and Jewish Family Services that have a sliding fee scale based on your income, as well as the UWM Psychology Clinic. They also can take new clients and have a fee based on your or a flat fee. All right. And then once you figure out your insurance situation, then what you could do is, you work on finding the counselor that's right for you. And pretty much what I say to people is that, you want to look for what are your preferences, what are the things that you want out of a counselor. Is the personality of the counselor really important to you, and what kind of person they are, what their gender is, race and ethnicity, are they LGBTQ, are they an ally, are they in that population themselves? Is that something that you're interested in? Some people feel more intimidated talking to somebody that's significantly older than them, or they don't necessarily feel like people with less experience are going to be as helpful to them. And then location and accessibility. These are all considerations to kind of think about, and to take stock of for yourself to see what is your preference, and then when you call in for your intake, to let them know what your preferences are, and if anything is sort of a non-negotiable, you really want somebody who is a female who has openings, and that's really very important to you, or something like that. Also, some things to remember are you can't get referrals. So, you can come to me as the counselor. I left my email address. You could email me and let me know if you have questions about getting a referral in the community. I can help with that. Sometimes people get referrals from their friends and or family. Although I do caution people not to get the same counselor as somebody else in their family, just because of some of the potential pitfalls of that. But being a consumer is important, and asking for what you want is important. You can request to have a phone conversation with the counselor. Most counselors will talk to you before they set up an appointment, and you can, or they do it based on request. Um, and trust your first impressions. It is I would say that that trusting your gut about how you feel about somebody is an important place to start, and you don't necessarily have to go with the first person that you talk to or the first counselor that you get in contact with. And if it doesn't work out for you, um, you know, then you can move on. Or if it's somebody that you've been meeting with for a little while, and it doesn't feel like it's working for you, I would say have a really candid conversation with your counselor about what it feels like is not working, and see if that counselor can accommodate for you. All right. Um, I just wanted to bring you back to my first page. Again, my name is Sean Ryan. I'm the University Counseling Case Manager. Here's my email address. If you have any questions about insurance or issues regarding community resources, please give me a call and let me know. But I hope you have a great day and take care.